MoStreBility. One of my favorite things to talk about is MoStreBility because it has so much to do with what we do as physical therapists, as we do as coaches, as we do as trainers. Let's first take apart the pieces of MoStreBility, which are motion, strength, and stability. Let's take a look at the motion component. When we talk about motion, we're talking about full joint, active range of motion in a functional position. Okay? So we want our athletes, our patients, no matter if they're healthy or they're injured, to obtain full active range of motion. Strength. Why do we need strength? Because strength is what gets us in and out of that motion. It's what produces the power for us to do work. So strength is a huge part. So when people talk about, I need to get my motion back, if they forget about strength, they're forgetting about a huge component of MoStreBility. Stability. What is stability? Stability is the ability to get in and out of that motion, having the joint in the right position so it's not moving too much or it's hypermobile, or it's not moving enough or hypomobile. We want that joint to go through full range of motion, able to produce enough strength to produce the power to get out of that motion, and to be stable, especially when we get to the end range of motion, so that we're not wearing out the structures that are supposed to be stabilizing us, actually wearing out the structures that are the secondary stabilizers because the muscles, the primary stabilizers, didn't get us in and out of that motion. So motion plus strength plus stability is MoStreBility, and if you have MoStreBility, your chances of being injured are little. Your chances of recovering from an injury are much greater, and your athletic performance increases. Without MoStreBility, you may have motion, but you don't have the strength or the stability to make that motion correct or make yourself able to perform that motion correctly. Let's take an example. Let's take an example of somebody who's actually healthy, not having any problems, who's an athlete. We run them through a functional screen and we decide they don't have enough hip rotation. So what are some different things that we can do to get that hip rotation back? Well, if we're looking for just motion, we can just take them and crank on that hip and stretch it, put it in that end range of motion just by using external force to get them there. And we'll get that motion. So we've got motion. But what did we sacrifice to get them in that motion? We sacrificed strength and we sacrificed stability. Now we send that person out there with great range of motion, poor strength, poor stability. What's going to happen? Decreased performance, increased risk of injury, joint breakdown. So the important thing to remember is motion by itself may be dangerous. Flexibility, which a lot of people want to obtain, is dangerous. Because if we look at the definition of flexibility, flexibility is the ability to achieve as much range of motion as possible, and it doesn't matter whether we control it or not. We could use external forces to get that flexibility. And how much flexibility is enough flexibility? If we can bend over and put our palms flat on the ground, is that enough flexibility? Why not stand on a 6-inch step and see if we can get our palms on the ground then? Why not see if we can get our nose all the way past our knees when we touch our toes? How much flexibility is enough flexibility? We don't know. How much MoStreBility is enough MoStreBility? Easy. Enough to achieve full active range of motion, the ability to stabilize it while you're getting to that range of motion, and the ability to get out of that range of motion safely because you have strength.